By 1914, there were around 1,000 women with medical degrees in Britain, but most hospitals refused to employ female doctors. Most women doctors worked as GPs or in hospitals where only women and/or children were treated. When war broke out, the War Office refused to employ female doctors in the Royal Army Medical Corps, RAMC, or in the official charities supporting the military. Some British charities that sent medical teams to Europe employed women doctors, while some overseas organizations such as the French Red Cross accepted British female doctors. For many British women doctors, it was their first time treating male patients. They earned the respect of some of their male colleagues and patients. In 1916, the War Office allowed women doctors to work in official medical units, but only in military hospitals in Britain. However, once the war was over, many women doctors lost their jobs or were relegated to junior positions despite their skills and experience. The number of qualified nurses working for the British Army hugely increased from around 300 in 1914 to 10,000 in 1918. Initially, the War Office only allowed nurses to work in base hospitals because it was thought they would not be able to cope closer to the front line. This changed after a few months due to the huge demand. The role of nurses increased throughout the war. They had to learn many new skills and were given more responsibility for patient care. By the end of the war, nurses were carrying out minor surgery rather than assisting. However, after the war, many professional nurses found that the increased responsibilities and tasks were taken away from them. The huge contribution of nurses was recognized by Parliament in passing the Nurses Registration Act in December 1919, which regulated nursing as a profession. Many women, some who did not work as nurses in Britain, volunteered to help through two main organizations. The First Aid Nursing Yeomanry supported medical services on the front line by dressing wounds and transporting supplies of medicine and food. From 1914, it worked with French and Belgian forces, but from January 1916, the RAMC allowed First Aid Nursing Yeomanry ambulance drivers, including women, to transport wounded British soldiers.